Hello and good afternoon, everyone. If you're just joining, please take this opportunity to introduce yourself in the chat. Just name an organization, and we're going to go ahead and get started. So welcome to the Feeding Greater Houston, Understanding the Scope of and Impact of Food Insecurity Lunchtime Learning Session, hosted by the Health Equity Collective's Food Security Work Group. My name is Alicia Johnston. I'll be facilitating today's discussion, and I'm a Health Equity Collective volunteer, and I co-lead the communications work group with Wes Gibson. A few housekeeping items at the top here. The meeting is being recorded, so if you do not wish to be recorded, please go off camera now. Please keep yourself on mute unless you're speaking. We do encourage you to use the chat again to introduce yourself, ask any questions along the way, and share resources. There is dedicated time for Q&A at the end, and then we'll also have some folks monitoring the chat throughout just to keep the session and the conversation going. And then the session, again, is being recorded. We'll collect all of the resources that are shared in the chat, as well as the recording, and send those out after the meeting. And then we'll also upload those onto our YouTube channel. Okay, so with that, I'm going to go ahead and go to the next slide. So just a little bit of background about the collective. The Food Security Work Group is one of 7 work groups that make up the Health Equity Collective, whose mission is to establish an impactful, sustainable, data-driven system to promote health equity. The collective grew out of the Clinton Health Matters initiative, which was active in our region from 2013 to 2018. And this multi-sector effort has grown to over 1,300 members and over 200 organizations and 50 coalitions. The Food Security Work Group launched in 2020, and its mission is to build on and improve existing food security efforts while developing a shared set of evidence-based interventions to improve food access and nutrition in our region. Today, I have the privilege of facilitating this session along with our Food Security Work Group leaders, Felicia, Jasmine, Maria, and Melanie. So our agenda for today included a bit of background, and next I'll cover learning objectives and introduce our speakers. Our speakers will introduce or help us understand the food security prevalence in Greater Houston and its impact on individuals and families. We will hear about some research examples in military veteran research, and then about some policy opportunities for this 89th legislative session. Felicia will then lead us through a Q&A at the end. So what do we hope that you will take away from today's session? We want you to walk away with an understanding of the prevalence of food insecurity, its impact, the populations affected, and the opportunities for policy change and advocacy. So without further ado, let's go ahead and meet our speakers. First, we'll start with Celeste. Celeste Hernandez is the 2nd-generation Mexican-American with a passion for community nutrition. Her career began as an intern for the Bounce program at the University of Houston as part of an obesity prevention program. Following this, she became a community health worker for Harris Health System's food pharmacy, where she provided nutrition education to patients with chronic health conditions. Currently, Celeste serves as the health promotion specialist at Houston Food Bank, where she assists with nutrition policy implementation, connecting with the community through the Health Pantry Project, and providing food insecurity trainings to professionals. Next, we have Dr. Nipa Kamdar. Dr. Kamdar is a researcher at the Center for Innovations in Quality Effectiveness and Safety at Michael E. DeBakey VA Medical Center and assistant professor at Baylor College of Medicine. She is also an adjunct nursing instructor at Cizik School of Nursing at UT Health Houston and a board-certified family nurse practitioner. Dr. Kamdar earned her bachelor's in nursing from the University of Michigan, Ann Arbor in 2000, her master's in nursing from the University of North Carolina, Chapel Hill in 2003, and her doctorate in philosophy from University of Texas Health Science Center, Houston in 2015 as a Robert Wood Johnson Future of Nursing Scholar. Through community-based participatory research methods, Dr. Kamdar seeks to reduce exposure to adverse social determinants to improve individual health and wellness. Her time as a family nurse practitioner, delivering care in low-income, underserved communities for more than a decade drives her research interest. Next, we have Carolina Cano. Carolina is the government relations manager for the Houston Food Bank, where she leads state policy and advocacy initiatives related to addressing food insecurity and its root causes. She began her career in the state legislature, serving as both legislative director and district director for state representative. In these roles, Carolina led the policy development and legislative strategies and fostered meaningful connection with constituents to drive impactful change. Carolina earned a bachelor's degree in political science from the University of Houston, and through her leadership, Carolina builds partnerships and drives systemic solutions to create healthier and more equitable communities. With that, I'm now going to pass it over to Celeste. Celeste, welcome to the virtual stage.
Thank you, and good afternoon, everyone. Once again, my name is Celeste, and I serve as Houston Food Bank's Health Promotion Specialist. It's an honor to be here today and share an overview of Feeding America's most recent food insecurity data, as we at the Houston Food Bank are constantly referencing these reports to inform our decisions and projects. Next slide, please. Starting at the national level, we will note that the number of people living in food insecure households in the United States in 2023 increased to 47 million individuals, including nearly 14 million children. And this is all according to a report released by the U.S. Department of Agriculture. This is equivalent to a 6% increase in 2023. These numbers only affirm what we continue to witness at food banks, pantries, and meal programs, and what we have been hearing from the people we are serving. Geographically, food insecurity in 2023 was higher in rural areas, cities, and in southern states. Food insecurity in single-parent households remained high in 2023, where food insecurity amongst members of households with children led by a single female rose from almost 34% in 2022 to almost 36% in 2023, or 1 in 3 individuals. Additionally, food insecurity amongst members of households with children led by a single male rose from 22% to 23%, or 1 in 4 individuals. And now looking at this data from a perspective of race, food insecurity rates continue to be higher for and disproportionately affect our communities of color, showing the effect of racial disparities in those communities. So both Black and Latino individuals experienced a food insecurity rate of more than 22% and were 2.2 times more likely to face hunger than white individuals. Next slide, please. At the state and local level, according to Feeding America's Map the Meal Gap report, the food insecurity rate in Texas and in Harris County in 2022 saw an increase to 16.4%, which is high compared to the national average of 13.5%. And even more alarming, however, is that only a year ago in 2021, the rate of food insecurity in Texas was 13.7% and 13.8% in Harris County. So what this data tells us then is that in the span of a year, there has been a dramatic rise of communities and individuals facing food insecurity. It's more than numbers. It's almost 5 million individuals constantly having to make those tough decisions to attain basic necessities they need to thrive. Next slide. Most recently, Feeding America released their Elevating Voices report, in which they surveyed neighbors across the nation who have received charitable food assistance and or experienced food insecurity within the past 2 years. And they found that respondents attribute key drivers of food insecurity to rising food costs, high inflation, low to no income, and the cost of rent or buying a home. Neighbors agree that steep food costs and the high cost of rent or buying a home primarily fuel food insecurity, and they emphasize that their ability to access enough to eat is often affected by unfavorable economic conditions. Neighbors' food affordability concerns are tied to that general sense of financial unease, with in fact 78% of neighbors surveyed feeling like they are only getting by instead of thriving. And only 40% feel financially stable and on top of paying all of their bills. Some neighbors have constant food worries and make a lot of sacrifices in their lives, whereas others are less likely to use or be aware of available food programs, but are still experiencing challenges affording food. And so these diverse experiences of people experiencing food insecurity highlight that a one-size-fits-all solution to ending food insecurity is simply not realistic. Next slide, please. And I conclude with this. food security and health go hand in hand. But a lot of the neighbors served by our food bank screen positive for food insecurity and are simultaneously experiencing a chronic health condition. This is all generating an even more pronounced cycle of stress in which an individual may now find themselves having to figure out not only where their next meal is coming from, but also how to best manage their conditions with those limited resources. From the same report, we heard that a lot of our neighbors want to buy healthy food, but their choices are shaped by bigger economic factors. And so when it comes down to it, affordability often takes the lead in their decision-making process. And it's a balance between those nutritious options and the more budget-friendly ones. Many neighbors are deeply concerned about how rising food prices and food insecurity in general are affecting the health and well-being of their communities, with 71% of those neighbors surveyed expressing that they would want to eat healthier, but simply can't afford to in this present moment. And so I hope that provides you all with a brief but conclusive overview of food insecurity in our area. And so this concludes my portion of the presentation, and I now want to welcome Dr. Kamdar for her portion of this presentation. Dr. Kamdar.
Okay, thank you so much. Before I get started, can y'all still see the presentation screens? I can't. Or you can, okay. Maybe I did something wonky.
At the top, make sure you're pressing Alyssa Johnson's screen. There's a row at the top, and if that button should be highlighted so you can see the screen versus just the participants.
That helped. Thank you so much for fixing that for me. All right, so now I can get started. My name is Nipa Kamdar, and as I was introduced earlier today, I am a researcher at the Department of Veteran Affairs and more locally at the Michael E. DeBakey VA Medical Center. And I was asked to present some of my research findings as they relate to veterans and their families and the community in general. So I will go ahead and get started with that. If we can move to the next slide, please. And so I know we all know the definition of what food insecurity is. Normally, I present this starting with the definition by the USDA. And then I quickly transition to this image of the refrigerator, because to me, this is the human definition of food insecurity. This photo was taken by a U.S. Navy veteran who is also raising an 8-year-old child. And as you can see, this refrigerator, it's a small fridge, it's the mini fridge, but there's even for its size, there's just not a lot of stuff in there. We don't see any fresh fruits or vegetables. We see very little protein. I see like a carton of eggs there and maybe some frozen meat of some kind in the freezer section. So it's like the lack of food here is really quite poignant. Next slide, please. And so when I was starting, this was back in 2018, and I was still trying to, like, the idea that food insecurity exists in the veteran population really hadn't gotten a lot of attention. And so when I first started back in 2018, I was still trying to just understand the concept of food insecurity in the veteran population and comparing that to the larger general population. And so to get me started with that, I started to look at secondary data sets like NHANES, for example, which has a lot of really rich information in it, collected in robust methods. The first question I wanted to know was, how do U.S. veterans compare to the general population? And so as we started to do some logistic regression analyses and things like that, we did notice that although the actual risk for food insecurity in the broad population, not those veterans that are seen specifically at the VA, but the general U.S. population, the veterans that exist there wasn't really a difference in the risk for food insecurity between these two groups. However, when we dig a little bit deeper and we look to see, well, for those veterans who are food insecure, how do they compare in terms of their risk for low food security versus very low food security? We did find some significant differences in that a US veteran, when we're controlling for all sorts of different socioeconomic conditions like parental status, education, marital status, income to poverty ratio, when we start to look at those things, a veteran who is food insecure is almost 3 times more likely than their counterpart, civilian counterpart, to experience very low food security. And when I went to some veterans, a group of veterans, to share this finding with them and to understand a little bit more of the context, they just kind of looked at me with a really blank look on their face and said, this is part of our training. In our military training, we learned that when resources are low, we should start to ration. So it just kind of automatically kicks in. The next slide, please. So in that, continuing to understand what food insecurity means in the veteran population, and also at a growing frustration with a research team that I was working with that was trying to help veterans transitioning out of active duty to civilian status. We were working on helping veterans transition, but at the same, the focus was primarily on a number of factors, but one of the things they weren't focusing on were like the basic needs, like food and housing. And as many times as I voiced that when we're talking about transitioning veterans to civilian life or active duty to civilian life, we really need to also be talking not just about like where your kids can go to school, where you can find employment, but we also need to be making sure that the veterans' basic needs are being met at that time. So really out of frustration, I did the second study. And again, I picked up the NHANES data set and then looked to see that if a veteran is food insecure, what is the association between depression and suicidal ideation? And let me preface that the larger study that I was part of that had me getting frustrated, their bottom line or their main outcome, primary outcome, was to reduce suicide in veterans. And again, they were focusing on a number of factors, but one of the things that they weren't focusing on was those basic human needs. So out of frustration, picked up the NHANES data set and I ran some quick regression analyses, and lo and behold, this was one of the first studies that came out connecting food insecurity to suicidal ideation and also depression, which this slide was getting so busy I didn't add that information. But connecting food insecurity to suicidal ideation. And the point of that is to say, if we're worried about suicide prevention in the veteran population, but we're not paying attention to some of those upstream factors of which food insecurity may be, we might, be chasing our tails in the wrong direction. And so this study was able to help fill in some knowledge gap. And then there's been additional studies from other researchers supporting these findings here. The next slide, please. So then as I started to get a bit of a better quantitative understanding of food insecurity in the veteran population, I also wanted to start figuring out, well, what can we do to help them? And for that, I needed to build a little bit more of a broader base knowledge in terms of what these families are experiencing. And so what I really wanted to do was like quietly shadow different veteran families and understand how they are getting food to their table. What processes are they having to go through? Where are some points of friction and struggles that they're having? Because at least to me, it felt like getting a healthy meal on the table isn't just about access to food. There's other components around it that need to be considered. So I wanted to understand the full picture. And so what I did was choose a research method called photo elicitation, where I basically gave different veterans cameras, like really basic cameras, not your smartphone cameras. And I told them, go ahead and take pictures of things that influence or factor into your ability to either get food to the table or that hinder your ability to get food to the table. And then I took those photos and let them be the interview guide as we sat down side by side, and they showed me their pictures and basically told me about their lives. So here we've got I've picked just a few example pictures. The first one is a shopping cart full of food, which a lot of us already know. Yes, when somebody's food insecure, they have to fill their plates with more affordable, cheaper, more processed foods. And I think with all the information coming out in the news about highly processed foods, this image of the food that's in the basket kind of highlights that sometimes for them, that's not a choice. But another factor that was part of this story of the mom who took this picture was, in her mind, she knew that these foods aren't particularly healthy. Like she knows ramen noodles aren't great for children, or that processed meats like hot dogs isn't good. And she knows that her kids like granola bars, but she has to buy other foods. The granola bars were like $2.50 a box, she said, which is outrageously expensive. Those were semi-quoting her. So these folks, they don't, that they're, as parents, they don't necessarily get to control what they're feeding their children. The other factor that came into play in the veteran experiences was the role of mental health and how that highly influences their ability to even like process, hey, I should make a meal for my family, or just their ability to go from point A to point B. A lot of them are struggling with a number of mental health conditions like PTSD, and sometimes it's the side effects of the medication that also interfere with their ability to provide what they need to do for their family members. And then, of course, we all probably are familiar, experience it ourselves. Time is always a struggle, at least in my life, but it's also was a struggle in the participants in this study, as we had 3 different participants take very similar pictures of the clocks on their stovetops. Next slide, please. So with all those photos that we accumulated from the different veterans, I put together this graph or this visual for me to understand, to help me organize the different factors that come into play when it's getting food to the table. So the resources, the personal capacity, and the cultural influence all played a significant role in the lives of these veterans in terms of determining the types of foods that they were eating, the quality of food that they were eating, and also the quantity of food that they were eating. And then as I was concluding this study, that then led to the question for my next study, because as I was talking to these folks, one of the things that they were talking about was SNAP or food pantries, or one of the things I was asking them about was like, okay, well, you're experiencing shortages in food, or you're having difficulty purchasing food. Have you considered SNAP, or tell me about your experiences with food pantries? And there was some pauses or some questions or some there was like gaps in that component of the story. So I wanted to understand that a little bit more, because when most of us are trained that when somebody is food insecure and they're experiencing a food emergency, we should refer them to SNAP, or we need to direct them to provide them with a list of food pantries in their local area or places where they can go to get some food boxes. So the next study, which I'm going to have you advance the slide to that one now, please. The next study was to understand what's happening in terms of, as a veteran who's experiencing food insecurity tries to access these 2 primary solutions that we have in the United States with SNAP and charitable food distributions, what does that journey look like? And how do the current solutions work for the veterans? So we can go on to the next slide. I think I already mentioned all of this stuff, so we can move on to the next one then. So in order for me to answer that question, I turned to a research method that you might have heard of called human-centered design. And in human-centered design, we really are trying to, the first step in human-centered design is to understand what the problem is. So in this case, for me, my big problem was, how can we better help veterans who are food insecure get the access that they need to food and any other needs that they have. And so for me to answer that, or to start addressing that problem, I first needed to understand a little bit more about what's happening with veterans as they try to access SNAP and the food pantries in particular. Next slide, please. And so what I did before I started the study is go through the internet and the research studies and everything else that's out there, look through toolkits put out by Feeding America. And there was this one image, I can't find it anymore, so I can't cite it, but it was like basically, if you are working with patients in a clinic setting, the first thing you need to do is identify who has a need. Then you assist them by providing them with resources. And those resources are generally to SNAP or to food pantries. So using that as my basic framework for the journey that I wanted to explore, I actually printed a visual of this out. And when I went to do my interviews with the veterans, the interview guide was actually broken up into each one of these, what I call phases. So phase 1 is identifying who is food insecure. Phase 2 is finding resources. And phase 3 is the actual connection to resources like SNAP and the resources of food pantry. Next slide, please. And so the study that we did had 30 veterans in total. Our average age of the veterans was 51 years old. We had a pretty equal sample of men and women, not entirely equal, but considering that this is a veteran population, we had a fairly good representation of women, being that they were 43% of the sample population, and we also had one transgender woman. Our relationship status, again, I was intentionally trying to find veterans that were single and veterans who were married or partnered. And we got like a 2/3, 1/3 mix. We also know that children play a significant role in households that are food insecure. So I wanted to make sure we had good representation of families with children. That was a little bit harder to find because although they were interested, when it actually came down to meeting them face to face and collecting data, a lot of especially the women who are raising children, disappeared. So we only got 36% of our sample population as veterans raising children, but that in itself might be a little bit of a story. Maybe they're fearful of sharing their experiences because they're worried about something happening to their children or them being considered a inefficient parent. So then again, in terms of when we were trying to break down, who's going to be part of the study, we were intentional about including veterans that live in rural areas, urban areas. And I was also trying to get down to the suburban area, but that got a little tricky. So urban and suburban is what we stuck to. Most of our veterans were not employed. Only 21% were employed. And then they did do an 18-item household food security survey. So this food security status is reflective of their responses to that. And you can see that we have a pretty high percentage of veterans who are very low food secure in this study. And this is after they were supposed to have gone through the journey of finding food assistance. So next slide, please. So when we started with that phase 1, which is identifying food insecurity, the questions started with, when you go to the clinic, has anybody ever asked you those hunger vital sign questions? And I would read to them what those questions were. And none of the 30 veterans that I spoke with who had gotten primary care at the VA in the 12 to 18 months prior to this data collection, none of them had been asked about their food security status, even though the VA did incorporate the hunger vital sign into their EMR and as part of their patient assessments in October of 2018. And this data was collected in late 2020, early 2021. So considering that, I was expecting at least a portion of them to say, yeah, we were screened, but none of them were. And we actually did go back into the EMR to verify their results because somebody's like, well, maybe they just forgot that they hadn't been screened. But they did offer some explanations as to why they may not have been screened. And again, this is the veteran culture coming through, where they talk about how they're trained to survive and how their appearance is very important. So when they present to clinics or when they present out in the community, even if they are homeless, even if they're don't have much in terms of materialistic stuff, they make sure that their physical presentation is neat. And they don't look like whatever somebody's struggling is supposed to look like. They don't look like people who struggle. So this was their explanation as to why they may not be asked, which is important if you're working in a clinic setting and you do have a veteran in front of you and there's a hesitancy to screen them for food insecurity or housing instability because the person in front of you looks very put together. That might be just them honoring their personal appearance and not necessarily reflective of their struggles. Next slide, please. So then the next question in that interview guide was, okay, so tell me about how you go about the process of finding resources. And there was a lot of different responses. A lot of people tell those that were already connected to a social worker at the VA seem to have the smoothest pathway to finding resources. But other folks who weren't connected to the social workers, they might have spent years trying to find something that maybe was just down the road. Like some of them didn't know about the veteran food drives that the Houston Food Bank was having on a monthly basis at the time of the data collection. But another thing that struck me as I was doing the interviews was a Marine veteran. So a Marine veteran who at that time was both homeless and also was volunteering at one of the smaller food pantries because that was his way of filling in the gap to get food. He talked about how he didn't feel like a real human being. He felt more like an ant. And he spoke about, his quote is right there. I'm horrible at reading quotes out loud, but basically he talked about how he felt very small, how he didn't feel like a human, and how people might think, oh, well, you know, an ant, they can carry a heavy weight. But he's like, I didn't feel like that. I just felt small. And again, like my takeaway from that as a clinician was we sometimes, if we're hesitant to ask a veteran if they need help, then the onus is put on them to ask for help. And when you're coming from a position where you feel small, you don't feel like a full human, you feel like you're maybe a failed adult, which is another quote that somebody once said to me, and you feel small, it's pretty hard to ask for help, perhaps, especially if you're coming from a military background where you are trained to make do with what you got and to, you know, figure things out. So this particular quote just kind of hit me. When he said it, it's kind of like hit me in my chest. Next slide, please. So then we get into the nit and grit, like, okay, well, we got solutions to this problem. So tell us about your SNAP application. Have you applied for SNAP? Tell me about those experiences. And in this case, there were a couple of things that came about with the SNAP story. One was everybody, all 30 veterans that I had spoken with had applied for SNAP. So they all knew about it. It wasn't a question of, well, what is SNAP? They had all applied, in some cases, multiple times. But the majority of them had been denied SNAP, primarily because their income was slightly above the cutoff point that we have here in Texas. Some said it was off by $20 because they were counting child support and they were counting their disability payment. So they were put over that income qualifier. The other thing that people talked about was the need to have internet access, a computer or smartphone, and a stable mailing address. And so those that were couch surfing, they might have missed important letters because SNAP, maybe somebody in this group can update me if it's changed, but back in, at least in 2021, it was through snail mail. So if they didn't get that hard piece of mail, they might lose their benefits. And then this quote was by a mother who was actually a victim of domestic violence, raising 3 children on her own, living in a shelter. During all of that, she applied for SNAP 3 different times and was denied SNAP 3 different times. And she was like, I've just been burned so many times, I don't bother. Next slide, please. So hopefully my Houston Food Pantry folks won't get mad at me, but we did ask them about the food pantry and their experiences there. And this is after COVID. So some of the food pantries that some of the veterans were visiting, like the Portwell Pantry, which they raved about, had closed. And so in general, the consensus was the food pantries are great. They're good. resources to go to. However, there was a disconnect between sometimes the quality of food, the quantity of food that they needed. We had a diabetic talking about how she got 30 pounds of white potatoes, and she's like, I can't eat this. Or we had a mother with a lactose intolerant child who got 3 gallons of cow milk. So a disconnect, but it's still a resource that they value as having for emergency situations. And I know that there are a number of food pantries that are dedicated specifically for the veteran population that are largely hosted by Combined Arms around the Houston and surrounding areas, and they're pretty well attended. Next slide, please. So ultimately, you go through this entire process and what comes of it. As I showed you in an earlier slide, we still had about 2/3 of the veterans going through this entire journey, still very low food secure, and the majority of them were still in limbo. This was more of a cycle as opposed to a singular journey with an endpoint. Next slide, please. So what's next? As a researcher, I feel like it's my obligation to, one, understand the problem, but two, then start doing something about it. So right now, I am just completed working with a design team to put together an intervention to help veterans who are food insecure. It's still in the research and development phase, but we are working on, because research is so slow moving, to find research funding takes like me about 1.5 years on average. I am leveraging my operational partners at the Michael E. DeBakey VA Medical Center, and we're starting to implement that intervention. Despite not having quite all the evidence to show its effectiveness, we're starting to integrate it into their programming. And then in time, I'll start to write some more grants so that I can properly evaluate the effectiveness of that intervention and see if we're truly making an impact. Next slide, please. Okay, so quick plug before I run out of my time. I am moving on and doing more research projects. If anybody here knows anything about the rural community, please email me. My email address is right there, nipa.com.va.gov. I am actively putting together a design team consisting of veterans, community organizations that serve the rural communities, and I'll find the healthcare team members that work in the healthcare settings. That problem, that's easy to solve. But if you are a community organization doing any work in the rural community, please reach out to me. I am rural dumb and I need to be educated because we're going to start working on some solutions to identify and assist veterans who live in rural areas. I need your help. So with that, I'm going to go on and introduce the next person. Carolina, please take it away.
Thank you so much. Thank you, Dr. Kambar. As she said, my name is Carolina, and I'm the Government Relations Manager for the Houston Food Bank. A little bit about my work. I lead the Houston Food Bank's policy and advocacy work at the state level. So I was asked to come and talk about the policy priorities and opportunities at the state level, some that are relevant to the group, and other priorities we'll be leading and supporting during the legislative session. Before I move on and talk a little bit about the policy opportunities, can you go back to the first slide really quickly? Thank you. For those that are unfamiliar, when we talk about the legislative session or you hear the 89th session, that means that every other year, so think in the odd years, your state elected officials go up to Austin for about 5 months, 140 days, and that is the only time that they are voting and passing various pieces of legislation. The number one thing that they have to pass is the state budget, of course, but then also they incorporate other pieces of legislation in there, which I will be talking about further in my presentation. Myself and alongside other coalitions and partners will be advocating for many policies that impact our work, but most importantly, our community members. And so I want to thank also Celeste and Dr. Kamdar for kind of teeing me up, because Dr. Kamdar talked about SNAP and talked about the issues that a lot of families face when applying for SNAP, and a lot of those root cause problems. So further ado, I'll talk about my first policy opportunity. Thank you. So One policy opportunity that I wanted to highlight that is relevant to the group is supporting a payment pathway for food is medicine interventions. What I mean by food is medicine interventions is medically tailored meals, food prescription, medically tailored groceries. These are really programs and interventions that are helping individuals improve their health outcomes. And so food is medicine interventions require high quality food and services. However, community-based organizations like food banks currently do not receive any type of reimbursement for providing food as medicine programs to our community members. So, which puts us in a financial strain on our ability to serve on a larger scale. And so two of the main components that we want to call out for this strategy is one, provide the flexible funding for what we're calling non-medical drivers of health. And also, of course, as we know, food is medicine interventions lower costs and also improve health outcomes by research and studies show. So one of the methods that we'll be looking at to provide that flexible funding is in lieu of services. So essentially what in lieu of services does, and I promise I won't get too in the weeds. I tend to get a little wonky about this stuff because I'm passionate, but I will keep it in simple terms, but in lieu of services provisions enable states to cover cost-effective non-medical services. So what I mean by non-medical services is the food intervention programs like medically tailored meals and food prescriptions. And those support, like as I mentioned, health outcomes in place of standard medical services. And it's making it an ideal pathway for food as medicine interventions to be sustainable and to receive reimbursement for these types of programs. And then, of course, as we know, Celeste talked a little bit about health outcomes. We know that these food as medicine initiatives can reduce hospitalization, lower healthcare costs for the state, and overall improve outcomes for chronic conditions like diabetes, heart disease, which is justifying the investment into the food-based interventions. And so through this collaborative approach, we can create a pathway to make food as medicine viable and ultimately scaling food-based health interventions statewide. And I am working alongside a lot of various organizations in the healthcare space that are informing the work, and that is number one priority. For me, we actually had been working on this since the last legislative session in 2023. And we didn't pass, but we're bringing it back this legislative session with a lot more coalitions behind this. And so I am hopeful, fingers crossed, that this will pass. Next slide, please. And so I would be remiss if I didn't talk about the Supplemental Nutrition Assistance Program like SNAP. Dr. Kamdar talked a lot about that in her study. So thank you, Dr. Kamdar. As she spoke, there's a lot of areas of opportunity for the program to be more successful, be more accessible to our neighbors and to our community members that need it. And so last legislative session, we passed two really important SNAP legislations. And I'll go a little bit into that. So the two that we passed last session, one of them was what we called a reentry SNAP. So that will allow members who are incarcerated to apply for SNAP 6 months before their release. So that was passed and that is in law. The second one raised the vehicle asset test limit for families when they are applying for SNAP. There are various different asset limits that families have to calculate in order to receive or in order to qualify for SNAP. One of them is the value of your vehicle. And so those limits have been raised since the last legislative session. That bill has passed and it is now law. This legislative session, we're really looking at the process as to how often individuals are being denied or accepted into SNAP. Our agency, HHSC, is working really hard, but of course, due to capacity in our system overall, that our eligibility system, it is very outdated. The agency is overworked, and there's a lot of administrative barriers that come to the eligibility checks for SNAP. And so one of the things that we want to do is streamline SNAP through a 6-month eligibility check. And that, of course, will reduce the administrative barriers for HHSC. I also talked about the eligibility system, which is called tiers. Again, it is outdated, so we are advocating on behalf with the agency on requesting additional funds to be able to update the system, which will improve application processing for SNAP and other state public assistance programs, and also address the wrongful denials and delays. So, and then also I will plug the Summer Electronic Benefits Program, Summer EBT. That is a that is a permanent program at the federal level. And states have the option to opt in or not. Unfortunately, Texas did not opt into the program last summer. It is not looking too good for summer 2025. So we are really advocating and pushing the state to opt into summer EBT, which is a program that would ensure Texas children have access to nutritious foods during the time of the year when they're not in school and cannot receive free and reduced lunch. Next slide, please. And again, I mentioned the root causes and I talk about food and SNAP, but I want to call out to the root causes of food insecurity. And a lot of what Dr. Kamdar and Celeste mentioned is the healthcare piece, the housing piece. And I often say that we don't have a food problem, it's a policy problem. Food insecurity is not about food, it's income instability for a lot of families. And so a lot of these root causes as to why an individual is food insecure is because they're also housing insecure, they don't have adequate access to healthcare. And so we are really as Houston Food Bank and our state association Feeding Texas is really looking to push and go in the direction of addressing these root causes of food insecurity. Also, what is called NMDOH, I mentioned it earlier, but non-medical drivers of health. So we'll be working with organizations like Texas Housers, Raise Texas, the Farmers and Ranchers Freedom Alliance, a tongue twister, but also known as FARFA, to be addressing these root causes. So looking at strengthening local food systems, by reducing farmer costs and food waste associated with second grade produce. So a lot of the time what second grade produce is the funny looking carrot, still as nutritious, still great, but just isn't, up to par with what we see at the grocery stores, quote unquote. And then also expanding housing affordability through housing vouchers. That's something that Texas Housers is leading. Oh, the first bullet point about local food systems, FARFA will be leading that and will be supporting 100%. The second bullet point, expanding housing affordability. Texas Housers is an amazing statewide organization that looks at housing instability and really working at the policy level to try to improve those who are housing insecure. 100% supporting them, and then also overall improve the income stability of families. So looking at mitigating the benefit cliff that makes it hard for them to transition out of assistance programs, and then protecting households from predatory lending practices, payday lending loans, and easing the burden on medical debt. That was something that has really skyrocketed, unfortunately, and it continues to grow. And so these are the three main areas. I didn't go too much in the weeds of it, but I will drop my information in the chat. If you want to talk about any more of them in depth, I'm happy to talk more about this. But I think that's my last slide. But one thing I will just plug in and say is that Houston Food Bank, I talk about us supporting or leading some of these initiatives, but we cannot do this alone. There are many coalitions in the state that rely on advocates and rely on other community members to be uplifted and speak out on these issues that are important to not only our work ourselves, but our community members mostly. And so by engaging with other stakeholders such as health systems, state agencies, advocacy groups, community members, we can really build support for all of these policy opportunities and eventually see a world where everybody is thriving. Thank you.
Thank you, Celeste, Nipa, and Carolina for your presentations. I think this was it was just really great the transition between you guys and also the subject matter. So we thank you for just coming on and joining us. We only have about 9 minutes left on the call here. And we're supposed to ask, I think maybe we have a few minutes to just take a few questions. So if there are any questions, you feel free to come off mute, or maybe you can raise your hand if I can see everyone. or you can add your question to the chat for the speakers.
Hey, I have a question for Nipo.
Yes.
I was just
Amanda,
wondering,
go ahead.
I was wondering if you asked the veterans of those who applied for SNAP, I was wondering if you asked them if they had assistance with filling out their application or if they filled it out on their own.
So great question. And the woman that I gave you the example of, the one that was living in the shelter, she was asking for assistance. She didn't get any, so she was applying hers by herself, and she kind of felt that if somebody had helped her, then maybe she would have understood how others were getting the SNAP, but she kept on getting denied. Another woman, I think she was describing an episode prior to COVID, so before some of these help centers shut down. She had gone to one, but getting there was hard for her because of transportation. And then she got there, and as she was like filling it out on a computer, she ran out of time. It was like 4 o'clock, and they're like, just shut it down, come back tomorrow. So I don't think they were actually helping her. It's more of giving her a place to apply. But that type of help that they get at the Houston Food Bank, where they can go there and have a one-on-one help assistance, none of them were doing that.
Okay, great. Thanks. Appreciate it.
Okay, any other questions? I don't see anything in the chat, but if you'd like, you can come off mute and ask your questions as well.
Hi, first of all, thank you for your work. And this was very informative. I'm curious, in terms of veterans, if there's been any experimentation or pilots with veteran to veteran peer interventions similar to the recovery community. So people who've been through the process, helping others who are just now starting or trying to navigate.
Yes, actually, that intervention that I was telling you about, that's still under research and development, it is in a setting that's like a group setting. So we have veterans who are food insecure or dealing with financial challenges, working with like supporting each other. It's not the veteran peer-to-peer, like it's not a one-to-one type of thing. And actually, I just did a scoping review, and I have not seen any peer-to-peer interventions for social needs. So that would be a great, perhaps, future means of addressing some of these problems that they're having.
Thank you.
Thanks, Peter.
Okay, I'm trying to keep up with the hands, but I might be missing folks. Are there any other questions? I don't think I see anything in chat. Okay, I guess we have just a couple minutes. So I just wanted to ask each of the speakers if you guys could quickly kind of just briefly talk about how, because there's an array of folks here from across different professional fields. If you guys could just talk about maybe one thing or one way to angle our work, whether that's through medical or healthcare, if we work in medical or healthcare facilities, or CBOs, or an educator in the education arena. If you could just orient us and say how we can support the work you're doing, whether that's at a policy level, particularly with the upcoming legislation, or other work with the Houston Food Bank or around veterans.
I'll dive in before we run out of time. As I said before, if you do anything in the rural community, I would definitely appreciate you reaching out to me, even if you don't have a lot of time. If you can just share your 2 cents and educate me a little bit about some of the challenges that are unique to rural communities, that would certainly be helpful.
Thank you.
And I would say for me, in the policy space, I mean, anybody can advocate. And so supporting policies that impact the nutrition, the food insecurity, the topics that we talked about, requires really multifaceted approach, but some of the things I'll just list out: engage with your policy members, know who represents you, hold them accountable to what they said they were going to do while they were, on the grounds during the election times, educate and provide opportunities for community members to step into the power that they already have. Community members are the experts in their communities. They know the problems that they are facing, and so only they can speak to those issues with expertise. And so encourage them to and educate them to participate in these opportunities. Advocacy campaigns. Jasmine did plug the Houston Food Bank's Action Center. Thank you, Jasmine. That is a website where you can go, and there is pre-written letters to your elected officials. You can find out who your elected officials are through there. I will be posting various campaigns based on the issues that I talked about, and you can go in there. It's like I said, a pre-written letter. You can edit it some, and then you just send it off to your legislator, and they have your advocacy in their inboxes. And then, of course, also leverage social media. We are in a day and age where social media is so large, and so leverage those public platforms as well.
Carolina's comment, continuing to have these conversations regarding food insecurity. In fact, the community health team at the Houston Food Bank offers a virtual food insecurity training once a month to all of its community partners. So I highly encourage for everyone to tap into that. At present, people can register to join by signing up via a Teams registration link that is sent out via email communications from our partner liaisons and posted in our partner portal. But alternatively, you could connect with us at healthpro@houstonfoodbank.org to receive that registration link. Just keeping everyone informed of all of the information we're receiving year after year, data sets, etc.
Perfect, thank you. So I just want to thank each of our speakers and also all of you who have joined on the call for this conversation. Thank you for your engagement and just all of the perspectives that you guys bring, those who came to speak, and then also those who are on the call who are engaged and actively participate within the Health Equity Collective. And so as we close out, I want to bring notice to links that Alicia posted in the chat around learning more about the Health Equity Collective. There's Mighty Networks, and then the recording will be on YouTube. Also, there is a post survey link that I just posted. Would love for you guys to fill it out. It should take, not long at all, less than a minute to fill it out, just so that we have some feedback about this session after everything is gone and the sessions moving forward. So this is a product of the food security subgroup. It's a working group, and then also there's a learning group or learning series subgroup who's organized this and has been working on this for the past couple of months. So we would love to hear any feedback you have. And I thank you for your time and wishing you guys a wonderful Friday.